Having a shortness of breath and muscle aches are common symptoms in COVID-19 patients when treating at home. People who infected with COVID-19, in addition to taking medication according to instructions, it is highly recommended to have activities to improve breathing ability, reduce muscle pain and fatigue. The practice of exercise at home should be recommended during the recovery period. To determine the stage of the disease, doctors examine and check for risk factors. When the evaluation is complete, the doctor, in addition to prescribing a nutritional counseling, will give advice on exercise during the recovery period at home. Hereby are suggestions from the Respiratory Department doctor in General Philippines Hospital about stretching exercise and breathing exercise that FO can do during the recovery period at home. Lesson 1. Stretching the shoulder muscle. Stand with feet shoulder width apart. Cross your left arm over your chest. Use the right hand to hold and pull the left hand right at the elbow position. Hold this pose for 15 to 30 seconds. Do the same with the other side. Perform the movement 4 to 10 times. Lesson 2. Stretching arm muscles. Raise your left hand over your head and bend your elbows so that your right hand touches the center of your back. Place your left hand on the right elbow and gently push your right hand down your back. Hold this pose for 15 to 30 seconds. Repeat the movement with the other side. Perform the movement 4 to 10 times. Exercise 3. Stretch chest and arms. Stand with your arms straight on the wall so that your arms are parallel to the floor. Turn away from the wall until you feel a slight stretch in your chest and arms. Being careful not to move your legs. Hold this position for 15 to 30 seconds and repeat for the other hand. Perform the movement 4 to 10 times. Exercise 4. Stretching thick muscles. Erect. Use your hand to hold one leg and pull it behind your butt. Maintain a straight back. Hold the pose for 15 to 30 seconds. Return to the original position. Do the same with the other side. The exercise can be done in the prone position. Perform the movement from 4 to 10 times. Shortness of breath is one of the 5 common symptoms in the COVID-19 patients. Besides fever, dry cough, fatigue, and sputum production, even some FO because of fear, it is easy to feel short of breath even though the lungs have not been damaged. In this case, breathing exercise will help a lot. Here are the breathing exercises for FO at home recommended by the doctor. Exercise 1. Pinch lip breathing. Principle. The pursed lip movement. Both create work to push the gas trapped in the alveoli out and blocks the air to keep the pressure and not to collapse the airway during expiration, thereby helping the lungs to better ventilate and increase oxygen flow. Doing. Sit in a comfortable chair and relax your body. Inhale through your nose, pursed lip for 2 seconds. If possible, hold your breath for 3 seconds. Pinch your lips to exhale through your mouth for 4 seconds. Repeat the movement of inhaling, pursed lips, exhale, pursed lips until feeling less breathless. Note: inhalation time is only half of exhalation time. Exercise 2. Diaphragm belly breathing. Principle: practicing diaphragmatic breathing helps the diaphragm work harder to support breathing. Doing. Sit on a chair, lean back slightly. Place one hand on your stomach and one on your chest. Breathe slowly and feel the movement of your chest and abdomen. Inhale the rising belly, then hold the breath for 1 to 2 seconds and exhale. The abdomen folds. Regular exercise is required to strengthen the diaphragm. If you can practice 3 to 6 movements at a time, then increase to 3 to 6 times a day. Note: when breathing correctly, the hand on the chest moves less. The hand on the abdomen moves up and down according to the breathing rhythm. The abdomen will rise with each inhalation and fall with each exhale. Breathe in deeply with force and exhale with force. Do not exert yourself when practicing diaphragmatic breathing. Exercise 3. Vertical breathing. Principle. Reduce tidal volume and respiratory rate. Add to slow and calm breathing. Relieves this fear. Start with a gentle inhalation. Exhalation. When not finished, exhale. Hold your breath and count silently until you can hold your breath. Then breathe normally. Practice 5 to 7 movements each time. Repeat 3 to 4 times a day. Above are the breathing and stretching exercise for FO when treating alcohol. Wishing everyone good health to overcome the pandemic.